The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives, where we are looking at pediatric health challenges from a different perspective, one that includes critical thinking, and we're not afraid to ask the tough questions. I am honored and thrilled to have a very special guest today, Dr. Lindsey Wells. Welcome to Pediatric Perspectives, Dr. Wells.
Thank you for having me. I'm excited to be here.
I sat through an incredible presentation you gave at a Children's Health Defense conference not too long ago, and I know you're speaking again at the upcoming conference next week. There is a parent track. I just have to make a plug for this because this is probably the most important organization for education on the chronic things our kids are facing. The parent track is still available, so check that out if you wish, and if you can get there, get there. Remind me where it's at.
So it's in Charlotte, North Carolina.
Awesome. If you can get to that conference, you absolutely should. I've attended many of them. You are a naturopathic physician based in Connecticut, specializing in children with special complex issues, PANS, PANDAS, autism spectrum disorder, tick-borne diseases, and other neurodevelopmental disorders. You're the immediate past president of the Connecticut Naturopathic Physicians Association, and you're a fellow. If you don't know how powerful this is, being a fellow of the Medical Academy of Pediatric Special Needs is not easy. I've been on the journey and I never quite completed. I mean, it's tough. These are the smartest of the smartest doctors in the country or in the world. You're also an author of a recent publication we may have time to discuss, folate receptor alpha autoantibodies in PANS and PANDAS. And then you're the creator of the Well-Minded Moms Club. And I just love your recent book, Super Sam and the Battle Against PANS and PANDAS. That's good, actually, especially for PANS and PANDAS. I couldn't put it down. I mean, it's a kid's book, so it doesn't take a long time, but it's brilliant. I mean, the messaging that the family gets as they read that book, wow. Anyway, so glad to have you on the show. Thank you for joining us. What is PANS and PANDAS?
Yeah, so I'll first start with the definition. So PANDAS is pediatric autoimmune neuropsychiatric disorder associated with strep. And then we have PANS, which is more of an umbrella term. And this is pediatric acute onset neuropsychiatric syndromes. So what this is this is a condition where a child has an acute abrupt onset of neuropsychiatric symptoms. That could be OCD, that could be tics, anxiety, food restriction, the list kind of continues to go on, but it's usually triggered by some sort of an infection. So it can occur right after an infection, or perhaps they were exposed to an infection and didn't present with the acute symptoms like a fever or cough, but instead just presented with the neuropsych symptoms. And so parents usually know something is very wrong with their child. Their child changes abruptly, and it almost seems like overnight.
I was in pediatric practice. I'm retired now, but having done pediatrics for 35 years, we saw these kids, but they are the toughest to, first of all, even figure out that this is what's going on. So maybe start there. If you're a parent and your child suddenly is not acting themselves, and you were listing some of the symptoms, how does one sort through that to figure out that it's actually PANS or PANDAS?
Yeah, that's a great question. I always say that my moms are the best investigators, actually. They're so dedicated and relentless to try to figure out what's going on with their child. And so I always have a lot of respect and give them a lot of credit, right, for the late hours, the research that they do. But again, it's really where you have your child presenting differently. Like all of a sudden they have acute onset of anxiety when this wasn't an anxious child. Like maybe they're having trouble separating from you. Maybe they're having trouble falling asleep at night because they're scared, or even having school refusal. That could be OCD when your child previously didn't have OCD, or they start ticking. And so really what I encourage parents to look for is if that child, it's again, that abrupt acute change in their personality overnight. And I always tell parents, you have to trust yourself. You have to trust your gut. You know something is wrong. Like this isn't a gradual onset of anxiety where maybe they would benefit from some therapy or maybe some nutritional support or maybe some medication for mental health. This is really due to a neuroinflammatory condition from an infection. And to your point, it is challenging to kind of figure it out because there is no test that rules it in or rules it out, right? And so it's really based off of clinical history. And that's why working with a provider that is familiar with PANS and PANDAS and can really ask the right questions and dig into the history of those weeks leading up to the change to try to figure out what is going on, really to separate it being, a primary mental health issue versus a neuroinflammatory issue.
Yeah. So it could be like you said, an acute mental health like change. And I think people are more familiar with mental health. It's like, oh, they've got all these labels, right? But if you go into your pediatrician with symptoms like, the anxiety, like you described, or OCD, which is repetitive movements or repetitive actions, right? How often are pediatricians getting this right?
Oh,
I was one, so you can hit hard here.
Not often. And, it's really unfortunate for the children and the families that are suffering from this, right? Because I think pediatricians, they don't have much time to spend and to ask the right questions to really dig into that history. They're just seeing how the child is presenting in front of them. And so they want to get relief for that child. And so they will utilize the tools that they have in their toolbox. But again, I think it's really important for parents to kind of think about the history, think before the onset, what was going on, because that then gives us clues. That gives the provider clues of like, there was strep in the house. You know what I mean? They had a strep infection 6 weeks before the onset, or there was a tick bite, in the summer, a few weeks before, or perhaps they had this cough and they've had a continued cough and, all of a sudden we start to see the tics, we start to see the OCD, the anxiety, the aggression, the baby talk, the urinary frequency, wetting the bed again. So again, I unfortunately, I don't think pediatricians are diagnosing it as well and as frequently as they should be, because this is much more common than we think. It's actually estimated that 1 in 200 children or 1 in 150 children will be diagnosed with PANS. That's not a small number.
Would you say that PANS and PANDAS is increasing in frequency?
Oh, yes, I would absolutely agree with that. And I also feel like when I first started my career really working with children with PANS and PANDAS almost a decade ago, I saw cases that were just strictly PANDAS. So these children were just triggered by strep. That was the germ that caused the initial onset, but then, they would have a relapsing and remitting pattern, and they would only flare with strep when they came in contact with it. Unfortunately, I feel like our kids are getting sicker or their immune system is becoming more vulnerable, and it turns into a PANS case where they then start getting triggered by many other germs, viruses, mycoplasma, other bacteria. And so it's really rare actually for me to see a strict PANDAS case anymore. Most of them start that way and then they move into the PANS category.
Are there other environmental issues? So you mentioned infections, but if something is on the rise in a massive way, which is what I experienced in my career. I mean, I didn't see this when I started my career, hardly ever. Maybe there's some environmental issues as well.
Yeah, so I'm actually giving my lecture at MAPS this upcoming weekend on the environmental triggers for PANS and PANDAS, because we focus a lot on the infections. But we do know, as part of the diagnostic criteria for PANS, that there are metabolic factors and there are environmental factors. Now, there's not a lot of research necessarily that is pointing certain environmental factors to being a contributor for PANS, but in my practice, what I see of the environmental exposures that can contribute to either onset or cause flares are, of course, mold, right? That's a huge issue that we're seeing now. It can be pesticides, just like what's on our food, unfortunately. Certain chemicals, chlorine actually is a very big trigger for our children with PANS and PANDAS. Stress, we know, can impact and cause a physiological response inside of the body. Now that can be, perceived stress for these children, or even just the physiological stress that's going on inside. And then the last is immunizations and vaccines being a trigger for, flares, very commonly I see in practice.
Yeah. Can you speak briefly about the findings of your cerebral folate deficiency article? You
Yes.
published a very important article, and I think it touches on autoimmunity. What's the message there in that article?
Yeah, so, we hear a lot about cerebral folate deficiency in the autism population, helping with speech and communication, helping to decrease autism symptoms. Now, we actually were testing for cerebral folate deficiency in our children with PANS that were coming into the office, and we were really surprised at our findings that we found. And so we ended up publishing about the prevalence, which was 63.8% of children with PANS and PANDAS were positive for cerebral folate deficiency, meaning they had antibodies that block the receptors on the blood-brain barrier, meaning these children weren't getting enough folate into their brain. And what I found most interesting was that our children with PANS and PANDAS actually had higher titer levels than what we see in children with autism. And I still see that consistently in my clinic. And it's just fascinating. And so when we were treating children with high dose folinic acid, we were seeing improvements in their symptoms. So seeing improvements in the anxiety, the OCD, the tics, executive functioning, the speech disfluency, so the baby talk or the stuttering. It was, significant for symptom support there. It didn't take down the infections and, it didn't take down inflammation, but absolutely contributed to supporting their symptoms and how PANS was manifesting for them.
Wow, this is huge. So let's pivot to how you manage a child with any of those symptoms that we've been talking about. Sounds like, and clarify for people too, the folinic acid is different from folate that people might be getting in a supplement or somewhere else.
Yeah, so folinic acid is one of the bioactive forms of folate. So it is different than folic acid. Folic acid, we hear a lot about. It's fortified in food, maybe in the lower quality supplements, there'll be folic acid, but folic acid is a synthetic form of folate that the body can't naturally utilize and plug into its pathways. So you want to use bioactive forms, which is folinic acid or methyl tetrahydrofolate. But research has shown that the benefit is really seen with folinic acid. And then when it comes to treatment for PANS and PANDAS, I strongly believe in order to get as much success as you want and to get your child relieved, you have to implement what's called the three-pronged approach, which is implementing symptom support. So perhaps that could be folinic acid from the cerebral folate deficiency, or this could be support for anxiety or OCD or however your child is manifesting. You need to put in antimicrobial support. And so antimicrobial support is going to be, either antibiotics or antimicrobial herbals specific for the germs that your child is triggered by or infected with. And then you put in immunomodulatory treatment. So that's anti-inflammatories or antioxidants or higher level immunotherapy. And so I believe that you need to have all three of those on board throughout the course of treatment. And I usually say we are in a long-term relationship when I'm with my patients and their families, because this isn't necessarily a condition that just resolves and goes away. There's 2 periods of time where we see improvements. That's either at puberty or that's at adulthood when the blood-brain barrier closes. So about 21 for females and 24 for males.
Interesting. I always thought the blood-brain barrier closed much younger. It's really open, so to speak, that long.
Yes.
I mean, we're not diagnosing or treating on this show, and these are just, you're giving information. Like you're the professor and we're the students. I would be interested if I was a parent with a child struggling with these issues because they're just so disruptive. Some doctors tend to keep kids on antibiotics, seems like forever.
Yes.
And we know that's also a problem. What's your approach for the antimicrobials? And then also, I'm more interested in a few more details on immunomodulatory support. That's a long name that I don't know what to do with if I'm a parent.
Yes. So in the research for PANS and PANDAS, they do use prophylactic antibiotics. And so usually it's penicillin or azithromycin. Azithromycin tends to be the antibiotic of choice because you can dose it once a day rather than twice a day. And then also you have coverage against strep mycoplasma. It has some coverage over Bartonella for at least 3 days after each dose, right? So that tends to be one that it's at least is used here on the East Coast pretty often.
How do you dose that, by the way, since it's so long acting?
Yeah, so it depends on the child's weight in regards to the milligrams. So 250 milligrams up to 500 milligrams. And then most people will do every day. And then there is the opportunity to potentially pulse dose it to get down to only taking it about twice a week for some children. But in my practice, my goal is to keep kids off of antibiotics because we know how antibiotics can disrupt the gut microbiome. And that can then cause some other germs like yeast overgrowth, and that can then present with some of the symptoms that we're also seeing too, right? And so that is always my goal, and I hope it's a shared goal with the families that come into my practice. I utilize a lot of antimicrobial herbals. I utilize them in glycerin form, so it doesn't have alcohol in it, but instead glycerin, and it's a little bit sweeter tasting and a little bit more palatable for the child when using herbals. But herbals also are very broad spectrum. They have the ability to hit more than just one germ. Unlike antibiotics, you have to be pretty specific on which antibiotic you're using for which germ. And our kids are pretty complicated and can have multiple germs. So that might mean multiple antibiotics. But with herbals, you can, pick certain ones that maybe hit bacteria, maybe hit viruses, maybe hit yeast or vector-borne disease. They also can help to break down biofilms, and they're gentler on the system overall for the child. And they're very effective, and I find them to be very helpful throughout the time span of treatment for PANS and PANDAS.
Which herbals, and I know we're not treating here, we're just saying these are some of the herbals that we found most effective. Can you name a few?
Yeah, so some of my favorites that I love to use in practice is golden seal. Golden seal contains berberine as its constituent, which is a potent antimicrobial. Oregano, just like the oregano that you cook with, but again, a stronger extract of that. Garlic is also another wonderful antimicrobial to utilize. And then for vector-borne disease, I use a lot of Japanese knotweed. Cryptolepis are probably my two tops there. But the list for herbals are really endless. But those are probably the most common ones I use in my practice.
Wonderful. Thanks for sharing that. And then to pivot before we wrap this session up on the immunomodulatory, what you found in your study, the high percentage of kids who have an immune-mediated something going on in the brain, right?
Yes.
Those antibodies against brain proteins. That I've found as a clinician back when I was practicing to be one of the hardest things to get under control. What are you finding most effective for that?
Yeah, so with children with PANS and PANDAS, one of the first things that you can put in to trial to see if this is a true inflammatory condition is actually using NSAIDs. Something over the counter like ibuprofen, not Tylenol, but ibuprofen. And the dose is 10 milligrams per kilogram, up to 600 milligrams per dosage. And what the research has shown is that if you put in something like that, some NSAID, it can decrease flare duration by 4 weeks. Wow. Which is significant. I mean, 1 day less a parent would take, and opt for. But this is something that's a really acute, quick trial to see if your child's tics get better, if their anxiety improves, if their OCD improves, if they sleep better that night. That shows us that this is an inflammatory process that's occurring in the brain. Again, that not necessarily a primary mental health condition, right? Because it wouldn't necessarily respond to an anti-inflammatory. So that is one clue. So I, again, don't love to utilize ibuprofen for extended periods of time because what it can do to the gut. But then I utilize a lot of natural anti-inflammatories. So things like curcumin or turmeric work very well. You just have to get the right dosing there. I use a lot of fish oil or specialized pro-resolving mediators, as well as quercetin or luteolin or rutin, these antihistamines that also have anti-inflammatory properties.
Wonderful. The ibuprofen, you gave the milligram dosage, which I'm familiar with that 10 per kilo, no more than 600
Yeah.
per dose. But how frequently would you dose that? Is it twice a day or?
Twice a day, but some
Mhm.
practitioners will do 3 times a day. But I think twice a day, at twice
Yeah.
a day, between 6 to 8 hours in between each dose, if this is going to be helpful or not.
Fantastic. So wrapping it up, how do you manage flares? So you've done all these things and your child is actually improving. Do these kids get actually symptom free?
Yes. And I always tell parents, that the goal isn't necessarily for us to never have a flare again, because that's almost unrealistic, depending on where the child is in their illness, how old they are, how many infections they have. But the goal is always to decrease the severity, the frequency, and the duration of the flare. And we can get to a point where we are just in maintenance mode, where we have one anti-inflammatory, one antimicrobial, and maybe something for symptom support. And so that truly is the goal. Now, how we manage the flares, we have to know the trigger and what triggers their flares. So for instance, if viruses are a flare, it causes them to flare, we'd want to have on an antiviral protocol for them. These are antioxidants like vitamin A, vitamin D, zinc, L-lysine, vitamin C, whenever they're exposed or they start to have acute illness symptoms or neuropsychiatric symptoms. I also think we need to know maybe the moons, the parasites could be at play for these children. And so the moon cycles can be a trigger for them. Or say dental work, like anything that has to occur with the mouth, that if they have a loose tooth or if they go to the dentist, that could contribute to a flare. If they are going to get a vaccine, we have to be prepared for that and, give them the supports they need to help decrease, again, the frequency, the duration, and the severity of a flare. And so it is possible to go symptom-free. It's just being realistic. We should always just be aware that we could have some flares, but as long as, again, we've decreased severity, frequency, and duration, we're absolutely on the right track until those 2 points of time when we see that PANS and PANDAS resolves.
I'm blown away. I've learned so much. I wish I could attend your conference next weekend. You're just a wealth of knowledge and information. Can people actually... I mean, I imagine if they're in North Carolina, they could drive to your clinic, but what about people around the country? Do you have an online mechanism for people to consult with you?
Yeah, so I do see people virtually. If my preference is always to see people in person the first time, just to be able to meet them and meet the child and do the necessary testing. But I do virtual consults. And I do have a parent course as well, if unable to come to my office or to work together. It's called PANS PANDAS Power. And this gives just a lot of the information we talked about today, but some actionable items too on what to do if your child is struggling with PANS or PANDAS.
Folks, those of you who want to connect with myself or my partner, Dee Dee Hoover, you can go to kidsfirstforever.com. I hope you enjoyed this episode, and I look forward to seeing you next week.
Okay, we are live. So this is a story about your 2 children.
Yes.
Okay, talk to us about it. What happened?
Yes, I have 2 children that were both vaccine injured, very clearly documented by medical doctors, and they both were very healthy children, babies growing up, no indication of anything wrong. At 15 months old, one of my children received the MMR and the DTaP same day. And within 3 hours, he was in my living room running back and forth as if his head was on fire. He was screaming in a sheer panic, and now I know he had encephalitis. I didn't know what to do. Took him to the doctor and asked him, would he report this to the vaccine court? He said, we don't do that. The next week, he developed full-blown measles, the rash, the fevers, everything that you would get with measles. The following week, he developed rubella. Same exact situation, the fever, the rash. Took him in both times to multiple doctors. They said, yes, this is what this is. And then within that month, he regressed. He stopped talking. He stopped looking me in the eye. He started doing some hand flapping within that month. At the time, I just had no concept of really what was going on. Just knowing, this is not right, something's wrong. Took him to a doctor later on who said that he tested him and his immune system had been suppressed. And he, within a few months, started to develop tics and some other like OCD and behavioral issues. And it ended up suppressing his immune system to the point that he developed PANDS, which is a pediatric autoimmune neuropsychiatric syndrome.
And how's that different from autism, PANS?
It's very similar, actually.
So they just changed the name?
Well, I wouldn't necessarily say so. There is controversy on it, but I would say it's very similar in lots of ways, and it can be treated similarly as well. You can detox the metals.
But so what's the difference between autism and PANS?
Well, PANS is usually a clear-cut, this is the instigator, whether it's a vaccine or whether it's some other toxin, whether it's mold or whether it's a, flu or some other kind of illness. It is the thing that actually creates it, or sparks it, I should say. With autism, what they say is, oh, you're born with it, or, it just develops and we don't know why. So yes, there might be, overlap. A lot of people do.
Okay, my son has PANS then, not autism. Thank you for that.
Well, it's worth looking into. My other child had DTaP at 12 months old, and he developed 2 types of seizures for 48 hours straight, nonstop. I don't remember the types at the moment, but one was where he was, shaking, a fine shake, and the other was where he was walking like he was drunk. Since then, he also has developed PANS, and he also has developed other diagnoses from that, misophonia, and OCD, and ADHD, and all of these things, because their immune systems couldn't handle these vaccines. They just really threw them off, and it has been a living hell for our family. Our kids were suicidal for a while. Once we were able to treat them, to detox them, and pull them away from some more inflammatory environmental things, such as living in mold, which we eventually lived in, get them away from EMFs, they have started to heal. And it's been a miracle that we have prayed for 13 years.
How much damage, I'm interested in this mold thing, because we had a family situation. How much damage can mold actually do to a young child?
A lot.
What would be the symptoms of mold, do you think?
Well, there's a plethora of symptoms. So your immune system can be suppressed by it. Your body's trying to fight off the mycotoxins and the mold spores at once. So if you get another illness coming at you, your immune system's already busy fighting those things off and really can't effectively fight off other things. And so you can have this whole inflammatory situation. A lot of people develop something called SEERS, which is a inflammatory bodily situation in your brain, your body, and you're hypersensitized to various like fragrances or mold or other chemicals. We were not thankfully that sensitized, but enough so that once we moved, our kids are almost completely better. But when they first developed these injuries, they were not living in mold. This was just a continuous situation that's just piled on their immune system from their initial harm that was done. So.
Thank you for that, because we're getting quite a few trickle of stories of the vaccine-free kids that are showing signs of autism, or they're having seizures or something like that. And I'm wondering whether there's mold, there's like you say, EMFs, and we're learning, or EMR, we're learning about all of this now, but I'm interested in the mold, so thank you for that.
Sure. So I'll say that Change the Air Foundation is an organization that is working to spread information about indoor health, including mold, and they have a summit coming up in September. It talks about, EMFs, mostly mold, but also lead and other indoor types of, things that can harm someone.
What are they called? Change the
Air Foundation.
Change the Air Foundation.
And they have some really excellent doctors. They have some celebrities speaking about it. And so it's really worth looking into.
Okay, another random question while I've got you. For a young couple that may be looking to buy a new house in a new state or whatever, how would they, is there a special kind of test, proper test?
Yes.
Not from someone trying to sell a house.
Right.
To see if it's clear, all these things.
Yes, and ERMI is the best test. So
how do you spell that?
ERMI and ERMI, and you can do it through various labs. Envirobiomics is one, Mycometrics is another lab. It's pretty much you get a Swiffer and you skim the dust around the house, you send it in, the lab will tell you what types are present and how much. It's not 100% bulletproof, but it's it'll help give you an idea. And there are certain mold types that are particularly bad that you want to stay away from, like the infamous black mold, for instance, Cotomium and some others. But any kind of mold can really set you off depending on your own immune system state and how full your immune bucket is at the time. So
Thank you for that. And now, so you said you also cleared your children up of this EMR, EMF. So is that things like Alexa and smart TVs? Is that what you're talking about?
We moved from an area that had very high EMF. So Northern Virginia area, they have a lot of cell towers, 5G towers everywhere. If you're next to people with these smart meters on your home, there were also some I forgot what it's called, but some big towers where they house a bunch of electrical information in the area. So it was just much higher. Where we are now, it's I think it's like 12 of them compared to I think 36 within the proximity of 5 miles. So things are much less of that inflammatory electrodynamic.
We're also hearing about fluoride, the water being an absolute huge. How have you addressed that?
Well, we've been using a Berkey for a long time. It's not foolproof, and I know that a lot of people would say that there are others that are better, but it's better than nothing for us. And where we are now, actually, the water comes from a deep aquifer well of pure water, deep under the ground that has no chemicals. They don't even put fluoride in it, which is great. So yes, there's a lot of things that can add to the person's bucket that can spill it over and causes all sorts of inflammatory situations, whether it be physical or in your brain and mentally.
And how are your children doing today?
They're doing great.
Okay.
I would say they pretty much have shed, 14 of 16 diagnoses among them all. So it is a true miracle that I prayed for many years. I'm just very thankful to God for that.
Yeah, absolutely. And you're an amazing mum and person. So thank you for sharing the story and giving us all your wisdom.
So much for this
I kind of want to
opportunity.
follow you, but I know that you don't want anyone even to know who you are. But anyway, there you go, everyone.
Thank you.